A very good evening. You're with Channel I, and we're about to kickstart a brand new episode of iMed, where we usually discuss a lot about several types of diseases which affect the human body and also their symptoms and also the complications as well, and at the same time how you can alleviate those said problems. Now, usually we bring in an expert of a subject in the field of discipline, of course, of medicine, and today we have with us an expert of the field of malaria. Now that will be the topic for today as well, and malaria and its related aspects. So today we have with us the consultant community physician of the anti-malaria campaign of Sri Lanka, Dr. Pubudu Chulasiri has joined us today. A very good evening to you and welcome aboard the show, Doctor.
Good evening, Sonal. Thank you very much.
And now, some of you might know about this. Now, the World Malaria Day falls on every 25th of the month of April, and it is celebrated worldwide, well, I should say commemorated. And also this time, they have issued a theme called Harnessing Innovation to Lower the Malaria Disease Burden and Saving Lives. Now, before getting into all of that, as usual, we have to define first what we are talking about. So, Doctor, my first inquiry to you would be, what basically is malaria?
Yes, malaria is an infectious disease, which means that it spreads from one person to another person. But the specific feature is that spreads occurs from a mosquito. If a mosquito bites one person and again it bites another person, and it spreads from that person to the other person. That is the specialty. So, we call it as a vector-borne disease. So, concerning the malaria, it happens because of a malaria parasite. Usually in Sri Lanka, there are 4 parasites which are called Plasmodium vivax, Falciparum, ovale and malariae. So, those are responsible for the malaria. So, usually very early periods in 1800s, people call it as a mal air, because of mal air, bad air. So, that came to the malaria.
So, that was basically how the name of the disease
was
name
of the
born.
disease born.
Okay.
So, usually when we call about this life cycle, so there are 2 stages. One is in the mosquito and one is in the human. So, when a mosquito bites one person, so it comes to his blood, the parasite comes to its blood through the salivary gland of the mosquito, and it goes to the liver of the person. And the symptoms or the features of malaria comes when that parasites come into the blood. But the sometimes the parasite come from the liver to the blood within 2 weeks time, but sometimes it comes within 1 month time, but sometimes it comes even after 11 or 12 months after it is infected by the mosquito. That is the issue, because sometimes, especially some people do get the symptoms, features of malaria only 1 year after they get bitten by the mosquito.
So, that is exactly what this malaria is about. That is the risk, risk of malaria. And now we talked about how this disease is spread, and now I want to ask you about this. The next question is about the etymology or the terminology of the question. So, now malaria, when we use the word in Sri Lanka, in the Sri Lankan context, when we use, is the word eradication correct, or should the word elimination be used?
Yes, Sona. Good questions, because mostly the people confuse with these 2 terminology, eradication and the elimination. Usually the term called eradication mean the parasite, the infective agents, okay, completely destroyed in the world, from the world, because we can't find that infectious agent in the world. If I give an example, smallpox, it's eradicated.
Eradicated. That disease can't be found anywhere in the world.
Disease and the agent. But elimination called, it is confined to a certain places, especially to a country. So if we are sure that this agent is not there in the specific country, we call that disease is eliminated from that country, but that agent and the disease is present in the other countries in the world. So usually malaria we have eliminated, not eradicated, because malaria is present most of the countries in African region, American region and the Southeast Asia region. So we can't call it eradicated. And
so when a country is concerned, we only can eliminate
definitely
malaria, but it's kind of hard to eradicate a disease from the world. That takes a lot of preparation, a big procedure.
Definitely, because like mosquito-borne diseases, we may not be able to eradicate unless we destroy all the mosquitoes. So usually this kind of disease we usually eliminate.
Okay, now our audience might be wondering why.
When I go to this slide, yes, because this when we call the malaria, it is a triad actually, because there is a parasite, there is a vector which is mosquito, and the human host there. So as long as we destroy both vector and the parasite, we can say that we will no longer have malaria. But if we talk about before coming that the mainly the why we talk about malaria, I will just briefly go to the history a little bit. Then it's very easy as to comprehend what we are talking. So actually Sri Lanka suffered a lot from the malaria for last centuries. Not only this last centuries, last few centuries.
I think, Doctor, we have considerable evidence starting from 1911.
Yeah, because actually before that we have some evidences, especially from Polonnaru civilization, Anuradhapura civilization. In the stone carvings they have mentioned these words. But from 1911 actually we got the written evidence, because first anti-malaria center was established in 1911. But we can remember the malaria incidences in 1933-34 era, because there was a huge outbreak of malaria outbreak in 1933-34. Around 5.5 million people were suffered and 82,000 deaths occurred, both children as well as adult. But at that time it was reasonably controlled after that, and after introduction of DDT, which is a chemical to destroy mosquito. You might have heard that word DDT. So we could achieve only 17 cases in 1963-1964.
So this is regarding the graph which
this is so in 1963 then WHO also started to declare Sri Lanka as the malaria eliminated country, as we have only 17 cases. But there were some issues with the control. With that, again 1967 and 68 there was a huge outbreak, started from Kataragama and Matali, and then for around 40 to 45 years we again suffered a lot with the malaria. Around 50,000 to 7,000 deaths sometimes reported in Sri Lanka, not death cases. And the recent outbreak was occurred in end of 1980s and beginning of the 1990s. But later, after that, we got several technical and financial inputs from the governmental organization, non-governmental, and also the international agencies like World Health Organization and Global Fund. And because of the effort by the staff of the anti-malaria campaign, health staff, people, and all these international agencies local intelligence agencies, we could achieve 0 deaths in 2007, and we got last 23 cases of indigenous cases. Indigenous cases mean the patient arising from Sri Lanka, not bringing the parasite from other countries. So, last indigenous cases reported in 2012. So, after that we have not been reported any malaria cases so far.
Any cases,
indigenous cases.
Any indigenous cases have not been reported in Sri Lanka. So now we did talk about Sri Lanka. Now if we look at the problem in a global scale, now what is the position of the other countries compared? What is the position of other countries? How are they dealing with this situation of malaria?
Yes, Sonar. Yes, because although we have eliminated malaria in 2012, almost all the countries in African region and many countries in South American region and India, even Thailand, Indonesia, Philippines, almost all the countries still getting cases, but mostly the African countries suffering a lot. Around in 2020, 243 million cases reported in the world, and around 6 million cases, 6 million deaths occurred. So, still they have not been successful in controlling the malaria so far, although there are several novel techniques of controlling malaria, still they are suffering a lot. So, if I say that, if I put into that map here, in 1900s almost all the countries in the world had malaria, but in 2020, you can see the dark brown areas, those are the countries which are affected from malaria.
That's in the present.
At the present, in 2020, we have data on in 2020.
So you could say Sri Lanka and the world in general has done a good job in fighting malaria.
Yeah, they are doing, but with there are several restrictions, there are several challenges they are facing. But WHO holds also projecting that there will be a very good outcomes within next decade in controlling of malaria.
Okay, and now when eliminating a disease, anyone can't do it without a proper procedure. So there must be numerous challenges when eliminating malaria from Sri Lanka. So what were those?
Although we eliminated malaria in 2012, still we are getting cases from these countries which I mentioned earlier, because most of the people from Sri Lanka go to these countries for several reasons, either peacekeeping missions, some gem businesses, some working to work in the upper garment sector, in the industries, they go there and work there. And also people from these countries, either as asylum seekers or some laborers or tourists, they come to Sri Lanka. So there is a huge migration from and to Sri Lanka. So always there is a risk of bringing the parasite from these countries to Sri Lanka. The elimination means, Sonar, we have destroyed all the parasite inside the body in Sri Lanka. That means we can assure that no parasite in the bodies in Sri Lankan people, but always there is a risk of getting the disease from the other countries. That is the challenge always, even at the current in 2021. So I will show you here this one. In 2021, 26 imported cases reported in Sri Lanka. In 2020, 31 cases, and so far in this year 16 cases reported in Sri Lanka. You might have not heard, you might be thinking, okay, no malaria there, but still we are getting cases, but they are not indigenous cases. But thing is, although we have destroyed the parasite, we have mosquito in some areas. So there is a risk of spreading the disease to the other people.
Now I did remember right now, we had a specific type of mosquito when it comes to spreading malaria. It's not all mosquitoes, there is a specific breed of mosquitoes. Now, as you said, correctly mentioned, there are imported cases in Sri Lanka from malaria endemic countries. And I wanted to ask, what is the specialty of these cases from patients, say, from Jaffna and Mannar? Is there anything different compared to other cases?
Yes, definitely, because for last 10 years, we got these imported cases from either Western province or Central province or mostly from Southern province. So, we got the cases, we treated them, but as we did not, as there were no vectors, mosquitoes who are responsible for the spreading of the disease, we were little bit relaxed. We managed them, but we were sure that okay, there will be no spread. But in Mannar, in Jaffna and Anuradhapura, okay, for last 10 years we didn't get any cases, but end of the last year and this year, within this first 4 months, we got out of 16 around 8 cases reported from either Jaffna or Mannar or Anuradhapura. So, thing is, we get the cases, but there are lots of vectors who are responsible for spreading that disease. So, vectors mean mosquito. There are usually primary vectors, we call them primary vectors, who have very high capacity, Anopheles culicipacis mosquito, and there are other types of Anopheles mosquito also. Those are prevalent in those areas, and also another special mosquito reported in Jaffna, Mannar, Kalmune and Vavuniya districts. So, the specialty is they are urban vector like dengue mosquitoes. They need only very few amount of water. So, they can breed in a very few amount of water. So, if we get the cases from this area, there is a huge risk of spreading that disease to others, and which will disturb our control activities.
I think the technical term or the scientific term, there was a scientific term to refer to this mosquito as well, doctor?
Scientific term in the sense, yeah, because these are entomology, yeah. So, which mean there are primary vectors, we call them Anopheles culicipacis primary vectors, and the other mosquitoes are secondary vectors. So, these are the mosquito who are responsible for these diseases. And so another specialty, Sohan, the cases we got from Jaffna and Mannar, there is a special characteristics compared to the other patients, because most of them tried to migrate from African countries. They go to these African countries for several reasons, and they tried to migrate to the other developed countries like USA, United Kingdom or Canada. After failing, they came to Sri Lanka, but they thought that we would not treat them as they tried illegally to go there. So, they did not reveal their proper history, travel history. So, there is a huge diagnosis delay, which might have caused spreading of the disease easily.
So, it would help you a lot more if the patients just open up to you about where their whereabouts, where they went recently. Otherwise, it's going to be very hard for you to, you know, what do you call that? To know that they are having malaria, right?
Yeah, because that is the most important thing, proper history. Because we don't take any legal action for anyone for that time. Even if they have malaria, we just treat them. That's all. We do. So, the most important thing is revealing the true travel history, and I will tell them later to present to us as early as possible. Then we will be able to manage them very easily and effectively.
I think that was an all-round answer for that question as well, and we have come towards the latter part of the program as well. So with that, we have to wind up today's session of iMed. Thank you so much, Doctor, for joining with us today and in an attempt to educate the public about a disease where people don't give much attention to, and that's malaria. So we had with us the consultant community physician of the anti-malaria campaign of Sri Lanka, Dr. Pubudu Chulasiri, with us today. And well, thank you so much, Doctor, again. But don't you worry, we will be continuing this discussion next week as well. So do stay tuned to Channel I. Up until then, have a very good night.
Thank you, Sonar. Good night.
Why are we still talking about malaria if malaria is eliminated in Sri Lanka? So your thoughts, Doctor?
Yeah.